Hello and welcome to this lecture about antihypertensive drugs. The objectives of this lecture are to discuss the different types of antihypertensive, but we're going to focus on the three main types here. We're going to look at ACE inhibitors, beta blockers and calcium channel blockers. Those are the three main types of antihypertensives that you will come across in the acute setting. So first of all, we'll have a look at ACE inhibitors. Now these end in -il, so tablets called ramipril, lisinopril, perindopril. If it ends in -il, no doubt it's a beta blocker. Okay, so ACE inhibitors lower blood pressure by decreasing peripheral vascular resistance, and they do this by blocking the angiotensin converting enzyme, also known as ACE, and that normally converts angiotensin 1 to angiotensin 2, and it's angiotensin 2 that is a powerful vasoconstrictor, and that's what normally keeps blood pressure, raises blood pressure. Okay, so if we block the conversion of angiotensin 2, that will vasodilate and reduce blood pressure. Now, it also decreases secretion of aldosterone, which reduces reabsorption of sodium and water. So this also has a secondary effect on reducing blood pressure. So now let's have a look at beta blockers, also known as beta adrenoreceptor antagonists. Such a mouthful, isn't it? Okay, so beta blockers end in -olol, so metoprolol, atenolol, bisoprolol. And they work by blocking the beta adrenoreceptor sites located in the heart, in the bronchi, and in the blood vessels as well. And the effects of blocking these beta adrenoreceptor sites is that there's a decrease in heart rate, myocardial contractility and cardiac output. And beta blockers also have a mild antiarrhythmic effect due to the slowing of the sinoatrial node function. So ultimately, beta blockers work by making your heart beat more slowly and with less force, thereby reducing blood pressure. Okay, now let's have a look at calcium channel blockers. They basically do what they say on the tin. They prevent calcium from entering the myocardial cells and walls of the blood vessels. Now, the effects of the drug are variable. It depends on what tissues and cells are working on, whether it's the cardiac muscle or the sinoatrial node or the AV node. So the effects on the myocardium would be a decreased force of contraction, and this decreased force of contraction would reduce blood pressure. Now, the effects on the sinoatrial and the AV node is that there would be decreased automaticity in the sinoatrial node and decreased conduction in the AV node junction. And this is what would slow down the rate of ventricular contraction, and this would result in a decreased heart rate. So I hope you've enjoyed this brief introduction to antihypertensives. This lecture is also supported by a worksheet to supplement your learning and explore antihypertensives in more depth. So I encourage you to do that alongside this lecture. Thank you for listening.